Hello, today's topic for the discussion is: will Mpox prove to be as dangerous as COVID-19, that is 2019 and COVID? There is a simple introduction. The global COVID-19 pandemic, caused by SARS-CoV-2 virus, has dramatically transformed public health, economics, and social system worldwide. With the emergence of Mpox, a zoonotic disease previously known as monkeypox, questions have been raised about its potential to escalate in pandemic similar in scale to the COVID-19. Mpox, primarily endemic in Central and West Africa, has attracted global attention after cases were identified in non-endemic countries, particularly in Europe and North America in 2022. Now, understanding Mpox. Mpox is a viral disease caused by monkeypox virus, which is the member of orthopox virus genus, which also includes the variolar viruses, what we call the smallpox. Okay, and the vaccine of viruses, which are very similar, and it is also used in the smallpox vaccine. It was first identified in 1958 in monkeys kept for research, hence the name monkeypox. However, rodents and other animals are primary reservoirs of the virus, with human to human transmission occurring through direct contact with infected bodily fluids, lesions, or respiratory droplets during face-to-face contact. The clinical presentation of Mpox is similar to that of smallpox, though generally less severe. Symptoms include fever, headache, muscle aches, and characteristics rashes on the body, especially as scab-like structure, while smallpox had a fatality rate of up to 30%. Mpox fatality rate varies, with Central African strain being more virulent up to the 10%, and West African strains have 1% to 3% or less. Now, comparing the transmission dynamics of Mpox and COVID-19. The key question when assessing whether Mpox could prove as dangerous as COVID-19 lies in understanding their respective transmission dynamics. COVID-19, caused by SARS-CoV-2, is primarily spread via respiratory droplets, aerosols, and surfaces, leading to the rapid transmission in crowded settings. It has a high reproductive number, that is RO, of approximately 2 to 3 without mitigation measures, though variants like Delta and Omicron have had ever higher RO values, contributing to their rapid spread. In contrast, Mpox is less contagious than COVID-19. Transmission predominantly occur through direct contact. The RO for Mpox is estimated to be less than 1 in most of the settings. This reflects in nature of the 2022 outbreak, where cases are largely linked to the close contacts, such as sexual networks, rather than the broad community transmission seen in the COVID-19. So, there is a clear-cut difference between the spread dynamics of the Mpox and COVID-19. Variants of concern in SARS-CoV-2, such as Delta and Omicron, demonstrated how viral mutations could increase transmissibility and evade immune response. Although Orthopox viruses, including Mpox, are generally stable and mutate more slowly than RNA viruses like SARS-CoV-2. It is not impossible that future mutations could alter Mpox transmissibility or virulence. So we must have to take care of all these things. And at last there is a conclusion. In summary, while Mpox has garnered attention due to its spread in non-endemic regions and its potential to cause outbreaks, it is unlikely to prove as dangerous as COVID-19. The key factors that made COVID-19 a global catastrophe: its higher transmissibility, asymptomatic spread, and lack of initial immunity. And these are some very important characters which are actually required for the highest rate of outbreaks, and these are absent in Mpox. These are not present to the same degree. Additionally, the availability of vaccines and treatments combined with more effective public health responses suggest that Mpox can be contained more easily than COVID-19. Now, severity and mortality rates of Mpox versus COVID-19. So, on the basis of clear-cut observation, but obvious that Mpox have very lower rate in the severity and mortality rates if we compare it with the COVID-19. Global responses and vaccination efforts make it very easy to fight against these endemics. Now, what are the future risks? Could Mpox evolve into a greater threat? While Mpox is currently less dangerous than COVID-19, there is always a risk that viruses can evolve. Yes, this is a very great threat. While vigilance is essential, especially in controlling zoonotic diseases, the current evidence does not suggest that Mpox will reach the same scale of danger as COVID-19. Thank you. God bless you all.